what I wanted to actually talk to you about, and this for me was where the most important premise I've always believed in. And when I've listened today, and long before I came here today, read the various stories or encountered, I was extremely sad and frustrated, as Margaret and Jean know, to hear about the stories that have not been good experiences. And I think it's very important that when we're talking to people is that we recognise that some people have very good experiences and some people don't. And sometimes we can forget that when we're talking about the bad experience or talking about the good experience. But I'm somebody who remembers the experience of what was prolonged and unpleasant deaths before the Liverpool Care Pathway came in. And so for me, the Liverpool Care Pathway was a tool, a means of enabling us within the acute hospital environments and other environments than hospices to bring those principles into the care of people and their families. It was actually, like all of us, and I think that's the thing that's come across here today, whenever you talk about death and dying, we're all personally connected to that because of our own experiences. And I've recently experienced the benefit of the pathway in supporting the death of my cousins as a result of Friedreich's ataxia. Some of you may not know it, but it's a very horrible, debilitating condition. It would have been better for my cousin if we could have done what she wanted to be where she was, but the timing didn't allow us. But I was so appreciative of how the staff gave her what she needed and what we all needed in terms of her death. But I had another experience where it fits to what Elizabeth was saying to you earlier on. My husband's grandmother, who was a very lovely, feisty old lady, did exactly, that path that Elizabeth showed you, where people go into hospital and go out and go in, but they're getting frailer. And the family were struggling to recognise that, but I was in charge of her care while they went away on holiday. And as it would be, she did one of those dips, and she was hospitalised where I worked. And I went down and did what I thought was the right thing, brought the whole family home. I've never forgotten it, I can tell you. Brought them all home and said they have to come, and we had her on the Liverpool Care Pathway. And she rallied. And we took her off the Liverpool Care Pathway. And I've never forgotten it, though, when she sat up and she woke up and said, "What are you all doing here?" And I was not popular because I had intervened in all people's lives, but I thought at that point we were on the end of that journey. So for me, this is what it's about. Wherever that setting is showing that we actually do give people the experience that they require. Wherever that setting. I'm a bit concerned that today it might have come across that if you were in an acute hospital, you won't have a good death. I'm not saying that it won't be. It could be not that experience because of some of the issues I'll address, but it can be. But it depends on where and what happens and what choices maybe the individual made, but sometimes what the family has made. And that can be as challenging as actually dealing with the individuals. There are some facts, though, and I think that given what the last few minutes of the debate that's been there, we know demographically there's an increase in older people, and there's an increase in demand for expert and end-of-life care. And there's no question about the debate we have to have, because it's a societal issue. Do we want to fund the right care for older people? Now, we all pay our taxes. We all do what we do. We all have a view about what we think where funding should go. And I think it's time to talk about, actually, how we do fund older people's care. Because I heard that concern earlier that was expressed about the public concern there is about the Liverpool Care Pathway, but we've been talking here today not just about the pathway, we've been talking about the quality of care. And if that has to be addressed, it must be, because care based on the lowest cost price isn't good quality of care and does not reflect well on our society. So it is a debate that we have to have, because if the cost price means, and I have, as the college, we've spoken very loudly on this, means that we drop the quality and the resources we give to the staff to provide that care, then that's not right. And that has to be explored and opened up. Sadly, the poor experience of a loved one or related stories heightens anxiety or fear. And there was a study done that demonstrated that preferences for place of care and death was definitely influenced by the experience of others. And I was saying to somebody earlier on, I am often frustrated when I'm dealing with my own members of the family, where my mother said to me recently, I'll not go into, it's not in this country, I'm not going into that hospital, I'll come out in a box. And it took me a long time to persuade her to go in for treatment, because they'd had some episodes of health-acquired infection, and she was really fearful. So we have to understand that and move there. But thousands of patients and carers and families are supported by the Live Care pathway, and what's clear, which I'll come to in a moment, is we've more work to do, more work to get that right, and more work to understand those fears. But the absolute essence of this, the environment that people are in, wherever that be, the acute hospital, hospice, their home, is essential to the care. But the environment is also essential to the staff who provide care. Where I might disagree with Jackie slightly is that actually when you get burnt out by a poor environment, you're not always the best person to provide the best care. And that's well researched and evidenced now, that actually that can impact on how compassionate people are. And that can be due to other pressures that are going on. So again, as a college, we've been very outspoken about where we're concerned how the environment creates the wrong place for both patients and their families and the staff. But I want to just quickly come to a concept that matters a great deal to me. And I think it relates to what was said earlier on. And it's exactly where Jackie was alluding to. To provide care, there's that common bond of that humanity. To give of yourself, to provide the care for people, whatever setting it is in. As a healthcare professional, you have to understand the impact on you as a human being. And I've been saddened to hear about a thought that, and it was expressed by one of the people at the table, that nurses being very, very distressed at the thought that they were doing something that was intended to harm their patients. And that is what led me to meet with Jean and Margaret, because that's exactly what was coming from our members, was the feeling that they were perceived as seeking to do harm by using the pathway. So being human and understanding that the relationship of humanity is between how you are human with those who you care for and how that matters to you. And over my career and over the number of times I've been doing, I have been left sometimes in a very lovely way, have had that experience of that giving of something with somebody that has a profound impact on me. But equally the opposite, where I have left or I spend time with people who feel deeply unhappy with what they believe they haven't been able to do. So I just ask you to remember that human aspect of healthcare professionals, that they themselves will be caught up in that dynamic too. In fact, in my career, I made a choice at one point to actually leave an aspect of care that I was very involved in. And sadly, I was one of the lead people around actually helping people who were brain dead and helping their families to switch off ventilators and make decisions. And I did it for a number of years, and I actually had to step away for a period because I found in fact, it did impact on my life. Because sadly, they were all very young. And it just, for some reason, related to my life And at that point, I decided I wasn't going to give the best of me in that. And that's a choice sometimes health professionals face. So it's all about actually remembering it's about that common humanity. Walking that journey with patients and family requires nurses, doctors, healthcare support workers, everybody, everybody that's in that care episode with people to actually give of themselves. And that's something we must never forget. But how do we improve and maintain that balance? We have to have the capacity to hear the experience and expertise of one another. And that's what I mean by that bringing that common bond together, to hear each other. We have to understand each other's responsibilities, and that was coming from Margot in her debate earlier on about understanding the responsibility somebody has and what they understand by that. There's always the risk of assumptions. One of the most difficult journeys can be where, and I think it was one of the people below said, what matters is the person who is dying. And I absolutely agree with that. But you can get caught sometimes in a myriad of problems where families don't agree. You might have one member of a family thinking this is the right time, this is the end, and another member of the family not believing that. And healthcare professionals get caught in the middle of that. And that can be very, very difficult. So engaging families and patients in decision making. What's clear to me that what's going wrong is communication. There's no doubt about it, we need more education and training. We definitely need to find more ways of collaborative working, and some of us were talking about that earlier. How do we join up and work together to improve this? And we have to be clear about, which has come out in the last short bit of this debate, inconsistent provision. Because, as I say, you can speak to people who've got a good experience and just go 10 miles down the road and speak to someone who's not had a good experience. And that's where we get inconsistency. What I see is that we're on a journey. But perception is the lens that we view life. So our experience, whether that be professional or personal, impacts on how we see things. And as I keep coming back to, this is about a public and patient wider societal view. It's about how we engage and talk about, which is why an event like this is so important, to talk about death and dying, and to talk about what's not working and what needs to improve. Because we must have those improved outcomes for patients and families. Because that dignity we've been talking about all day here, and that promotion of a good death is at the heart of what that is. My final thoughts is what we don't want to lose. The pathway was a tool for me that actually helped change things for the better. The fact that it's not working as well as it should is important to acknowledge. So the task in hand is to actually improve that, to go further, to absolutely ensure that we tackle where those issues of concern. And I want to bring back some of the mentioned earlier on about the patient opinion website. That's just been, great organisation at capturing experiences of people. And I would urge people to actually take note of that, because it's a good thing for Scotland that that's been well and truly now supported to actually get that heard. This is Gigi with her daughter, Barbara, and she experienced it was a death that was enabled by all to ensure that was what she wanted to be. What strikes me about that picture is the change in demographics of our world, that you can be yourself heading into needing support and care and saying goodbye to your loved ones. It's an interesting demographic we're in, which wasn't the case. Now I'm going to end with a short film, which I'll step down and let you watch, which Jack's very going to kindly sort out in a moment for me. This is actually called My Right to Choose. My own chief executive came across this it was sent to him by a nurse who actually had seen it. And when he showed it to us the first time, it had a profound impact on me, because it was all about actually understanding that older people should have value and matter in our society, just like all other spectrums of our society. And we need to actually recognise that if we are shortchanging that, we're shortchanging something in our society.
My name is Jack Hamlin, born in 1918. Worked hard all my lifetime, served my country and queen. Never knew my own father, killed in the Great War, blown to hell in the carnage when he answered the call. Got married to Mary in 38 and wept with my comrades at the Brandenburg Gate as we prayed for the fallen of another damn war, slaughtered and butchered like my father before. And they want me to leave, but I don't understand. I can walk on my own, I just sometimes need a hand. I still have that spirit and a glint in my eye. Seems I'm too old to live now, but not ready to die. My Mary has gone now, I miss her so much. Her laughter, a smile, and the warmth of a touch. Struck down by the cancer early last year. My wife and companion, God, I wish she was here. And they want me to leave, but I don't understand. I can walk on my own, I just sometimes need a hand. I still have that spirit and a glint in my eye. Seems I'm too old to live now, but not ready to die. I don't want a placement, just my right to choose. Give me a chance, I've got so much to lose. I've lived in my home the past 68 years, my home full of memories of laughter and tears. And they want me to leave, but I don't understand. I can walk on my own, I just sometimes need a hand. I still have that spirit and a glint in my eye. Seems I'm too old to live now, but not ready to die. Too much of a burden, too much of a risk, just a name for funding on a delayed discharge list. Please give me a chance, just watch me try. With home care and nursing, I know I'll get by. And they want me to leave, but I don't understand. I can walk on my own. I just sometimes need a hand. I still have that spirit and a glint in my eye. Seems I'm too old to live now, but not ready to die. So give me your hand now and then watch me fly. For I'm old, but still living and not ready to die.